Carpal tunnel syndrome is a peripheral nerve condition that is caused by compression of your median nerve as it travels through your carpal tunnel. The carpal tunnel is a narrow passageway formed by the carpal bones at the bottom, sides, and transverse carpal ligament on top. Structures passing through this tunnel includes the flexor tendons of the fingers and the median nerve. Compression of the median nerve results in symptoms like pain, numbness, tingling over the median nerve distribution, and weakness of the wrist, hand, and finger muscles. I will discuss the risk factors that predispose patients to this condition and physical therapy treatment considerations. The most common cause of CTS is increased pressure within the carpal tunnel due to the inflammation and swelling of the flexor tendon synovial sheaths from underlying conditions. Some non-modifiable risk factors include age, gender, pregnancy, and diabetes. CTS is very common in adults 40 to 60 years old due to age-related degenerative changes and cumulative repetitive use. Women are more likely to develop CTS due to the smaller carpal tunnel anatomy. Pregnant women are at a higher risk due to fluid retention and hormonal changes, which increases the carpal tunnel pressure. People with diabetes are at a high risk as well because diabetes makes the nerves vulnerable, it contributes to the flexor tendon thickening, and there's reduced blood flow in the peripheral nerves. CTS can result in repetitive wrist motion, especially repetitive overextension, which increases swelling and inflammation, further compressing the median nerve. Modifiable risk factors include poor wrist ergonomics and positioning, repetitive wrist motions, obesity, and occupation. Poor ergonomics, such as prolonged wrist extension due to improper keyboard and mouse positioning, can increase carpal tunnel pressure. Repetitive wrist motions are very common in jobs that requires frequent gripping, manufacturing, construction, even being a hairstylist, and the use of power tools. Obesity may also contribute due to increased adipose tissue, which raises pressure and systemic inflammation, further adding to tendon swelling. Treatment for CTS focuses on education, use of modalities, pain management, and therapeutic exercises. Educating patients on avoiding overuse of wrist movements and prolonged extension is very crucial to promote healing. Patients are encouraged to maintain a neutral wrist position during work or while doing daily tasks to have this adequate rest for your wrist and hand. Night splinting is often recommended to reduce pressure and to avoid aggravating positions. Evidence-based therapeutic exercises such as nerve gliding show significant improvement in symptom relief. This is where you're gonna bend your arm and your head close together, and then they're gonna extend all the way, even your head on the opposite direction, and then you keep doing that. Nerve gliding promotes median nerve mobility through the carpal tunnel, and it also promotes blood flow, helping reduce symptoms. Strengthening the forearm, wrist, and hand muscles can increase endurance, but this needs to be done carefully to avoid repetitive strain. Overall, treatment considerations should avoid positioning where the symptoms might increase, neutral wrist positioning, and ensure gradual progression, monitor symptoms closely, and provide adequate rest.